Hello, everyone, and welcome to the lecture series on medical research training. So, this would be the first lecture on this lecture series, and we'll be starting off with an introduction to medical research. I am Dr. Lamin Jaita. So, medical research, if we were to ask that question, what it would be simply defined as a systematic investigation of human health and disease with the ultimate goal of trying to improve patient outcomes and also advancing scientific knowledge. This would encompass a wide range of disciplines, varying anywhere between from basic sciences to clinical trials. And all this is driven by a passion for discovery and a commitment to enhancing healthcare. We'll be looking at the different types of medical research. That can be divided into three. You have basic science research, we also have clinical research and translational research. Basic science research is a type of research that focuses on understanding the fundamental mechanisms and processes that are underlying human health and diseases. And often this is done at a cellular or at a molecular level. Clinical research, as the name suggests, this is the type of research that happens within a clinical setting and often involves studying directly human participants, includes the evaluation of new therapeutics or diagnostic tools and interventions. So translational research serves as a bridge between these two types of research that we've already seen, between the basic science and the clinical practice that is aimed at facilitating the rapid application of research findings to help improve patient outcomes and healthcare delivery. So why do we do research? And I think this is a very, very important question. Currently, all our medical knowledge and understanding within the scientific domain comes from research. The established facts that we have, most of them have gone through some sort of medical research or scientific research based on the domain that the research is carried out on. And as I suggested at the beginning of this presentation, medical research basically is here to sort of fill out the gaps that we have in our knowledge when it comes to science. And that research has to be an ongoing process to help confirm findings that were done in previous research projects, and also try and build up and create new knowledge when it comes to research. So there are various ways of classifying subdividing studies. So basically, studies can be divided into positive or negative. Positive meaning that you're able to respond or answer to the research question, or for example, if it was a drug trial, you're able to prove that the drug is actually efficient. And a negative study would be quite the opposite. Usually, both positive studies and negative studies do contribute to the general scientific knowledge base. So the ideal situation would be to have a positive study which is able to prove a true hypothesis, or a negative study that sort of correlates with a false hypothesis. So in each of these situations, for example, a positive study, in your study, you're able to prove that this particular drug is quite effective, and in reality, it actually is effective, which meaning that you have a true hypothesis. A negative study would be quite the reverse. The situations wherein you would not want to find yourself is when you have a mismatch. For example, a positive study with a false hypothesis and a negative study with a true hypothesis, both situations being bad. But obviously, the positive study rather, with a false hypothesis would be a worse situation, wherein your study says that something is actually efficient while in reality it's not. So that would be a scenario wherein you would try and avoid when you're doing research. Again, negative studies are also beneficial in the sense that they do contribute to science and sort of confirm prior knowledge on that particular subject of research. One of the importance of research is that one study can go wrong, so it's always good to have a multitude of studies. So that's why, regardless of the knowledge we have in any particular domain, there's always more and more studies done on similar topics, maybe differences here and there, but generally research is an ongoing process and it's something that continues to go on for quite some time. So what does the research process entail? First of all, before starting any research, it's important to identify a research question. So in essence, the question is, what is the question? So you need to be able to formulate a research question, which means that you need to be able to identify the problem or the knowledge gap that needs to be addressed. And this is what serves as the foundation of any successful research study. After you've been able to formulate your question or idea, you would have to conduct a literature review in which you'll be examining the existing body of research that helps you understand the current state of knowledge and also be able to identify areas for further research. From your study, you would move on rather to your study design, where you carefully consider how the methodology you're going to be using, how you're going to select your sample, your data collection, and all these are very crucial in ensuring that you have research that's valid and reliable. You would also have to eventually, at the end of your research, disseminate those research findings. But just coming back to the first step, which is the actual defining what your question is, it depends on what stage you are in your academic career, whether you're a medical student or you're a junior doctor or senior doctor or maybe a researcher. The way you're able to formulate and come up with your questions varies. So for somebody who is probably a clinician with a good number of years of practice, during your practice, you would eventually come up or come face to face with situations wherein you would be asking yourself questions based on your experience or maybe things you've seen during your clinical practice. And those would tend to form the foundation of your research question. But for those who are further down on the other side of the learning spectrum, wherein they're just beginning or probably they're medical students, idea generation tends to stem from interactions with those who most likely have some sort of knowledge on the subject matter. So this may involve interactions or asking a senior, whether that's an immediate senior or probably a consultant in a particular area, what ideas they had on a particular subject of interest, and they can propose certain topics to you for research. You can also have a mentor who can also make suggestions on areas where there are gaps in our knowledge when it comes to the medical domain, and they might be interesting subjects for research. Conferences and lectures are also great places for one to be able to get ideas on research, because these are areas or places where you tend to meet people with similar interests in terms of the medical domain. And based on lectures or presentations that are done at those conferences, they might spark interest in a particular topic, and they also might be able to sort of ask certain questions that may be a subject of your interest in the future. So that's also a very likely place where we can come up with ideas. Others would be publications. So you have a particular interest maybe in cardiology, and then you're reading articles on cardiology. And with most publications, there's a particular question that's being asked, and that question may or may not be answered within that publication, or maybe partially addressed. But then there's almost always more questions that are asked, and those can be a subject for research as well. And those are places where ideas can be generated for further research. So formulating research questions, there are certain principles that are important. It's important to have a very specific and answerable question when it comes to your research question. It should be clearly defined. It should be something that's focused and it's based on available resources and data. It's also important that your research question is relevant and impactful. So it's a research question should be able to address important issues or gaps within the field that you're interested in, and should have the potential to be able to contribute to the advancement of medical knowledge within that particular domain. It can be probably research that's peculiar to your population, perhaps. It can be research that's of interest to your age group or your sex. So basically, it has to be something that's relevant and something that can actually have an impact, first of all, on perhaps your community and eventually to the wider scientific world outside. The research also has to have ethical considerations. So it has to be a research that does not violate the rights of the patient. It respects the confidentiality of patients, and it's research that would be beneficial to patients at the end of the day. And also research that respects internationally held norms when it comes to interactions and collection of data, patient confidentiality. So your research question needs to be able to embody all this. There has to be a feasibility assessment to see how feasible your research is in terms of the resources that you have available to you, in terms of time. If you're trying to do research for example, in the case of medical students, your final year dissertation, you need to take into consideration the timeline that you have in order to be able to do that research. So that should be one of the criteria that you do look into in terms of feasibility for that research, and also the expertise. If you're doing a particular type of research topic, you would need either a collaborator or somebody who may have knowledge on that topic, whether a colleague or maybe a mentor of some sort, for you to be able to carry out that research successfully. So these are some of the factors that need to be put into place when we're trying to do research and formulate our research question. You need to be able to develop a research proposal and the components of a research proposal and how to write a strong research proposal. These are topics that we will be looking into in subsequent lectures after you've had an overview of most of the different subsections and topics in medical research. So this is something that we'll be having an extensive look at in our subsequent lecture. This gives you an overview of how the research process is. So you start off with a research question, which gives you a hypothesis at the end of the day. And then eventually you test the idea. You have ideas on testing that hypothesis. And once you are certain that this is something that's feasible, something that's relevant, then you go ahead and sort of look at how much it would involve in terms of cost. And this would would vary significantly based on, again, the stage of your research career. If it's somebody who's in medical school and wants to do research that's within a particular teaching hospital, then perhaps the amount of funding that they would need would not be as significant as somebody who's doing a countrywide or regional-wide research in which they're dealing with hundreds and if not thousands of research patients, and the logistics behind it, having a whole team behind it, would definitely require a significant amount of financing. So this would involve writing grants to organizations that are able to help fund these research projects. So the grant writing is a whole process of itself. It involves sort of clearly stating what your objectives are, what the expected outcomes are, what the benefit is for the community that you're trying to serve. So once you're able to get the grants after writing a grant proposal, then the data collection starts, and then you analyze and eventually write your manuscript. And again, this may vary based on what your level is. For most researchers, it would involve writing a manuscript and submitting it to a journal. For medical students, it may involve sort of writing a thesis and then eventually having it judged by a panel of judges within a medical school or teaching hospital. So for those who would be writing manuscripts and submitting it to a journal, the submission would involve the process of having that article being reviewed by a group of experts. So it goes through a process called a peer review, wherein questions are asked, clarifications are made by the author in order to make sure that the article that comes out is of the highest quality possible. But however, this process of a peer review can involve a lot of back and forth wherein you can have several suggestions and even more questions after an initial review being asked by the peers, and then eventually before it gets validated in terms of being accepted within a particular journal. So again, this process can take several months for certain research projects. So the literature review we mentioned, this is a crucial part. Once you've been able to get your research question, you would have to look into the literature and see how much knowledge is there when it comes to this particular topic. So when it comes to literature review, there are different ways of doing it, and some of the key components of a comprehensive literature review would be having to do a comprehensive search, and this search would involve literature review encompassing a wide range of relevant sources. So these sources can include journals that talk about this particular topic. They can include books, and they can also include conference proceedings. So all these are important areas wherein you can actually be able to find information concerning the question that you're trying to do research on. Critical appraisal. So researchers must carefully evaluate the quality and validity and relevance of existing literature in order to be able to identify gaps and guide the formulation of their own research. So you need to be able to look at a certain article and then look at what the eventual or possible gaps are, and that would be able to inform or help you visualize and make more concrete your research question and have a clear idea of what questions you're trying to answer. And obviously that you have to have synthesis and insight in order to be able to have a clear understanding of what the current status or state of knowledge is, as well as identifying areas that would require further investigation. So a literature review would go through a certain number of what I would call search engines for research. We all go through Google in order to search for items online. And it's a similar mechanism when it comes to medical articles and journals, in which you have specific search engines for medical research. So some of them I'm sure we've come across. So one of the most common ones is PubMed, which serves as a sort of librarian into Medline, giving you access into the library of the National Institute of Health, which allows you to have access to a vast array or number of articles that can be used for your literature review and would help in giving some sort of background knowledge into the question that you're trying to answer. Google Scholar is similar to PubMed, but it would include some of the articles that you may find in PubMed and some other publications like thesis or dissertation writings that you may not necessarily find on PubMed. Scopus and Embase, they are also databases that actually allow for literature review, but they are subscription based, wherein you would have to have some sort of subscription to be able to access them. Cochrane, Web of Science, and NIH, clinicaltrials.gov. So these are some other databases that can actually also be used in order to be able to do extensive literature review on whatever topic that you decide to look into. So there's a concept of an open access and subscription-based journals. So open access journals are basically journals in which the author or the funder, the country or the institution pays what's known as the article processing fee. And what that does is it allows for that particular article to be accessed freely by anybody once it's published. And this is the reverse with subscription based, wherein these are articles which require you as the individual trying to access those articles to pay a subscription fee, or perhaps the subscription is through your university or teaching hospital or library or other institutions or companies as well that may have subscriptions to certain databases. One of the ways in low and middle income countries would be sort of going through Hinari, which allows you to be able to have access to these journals through your library. You can also do it the old-fashioned way where you can actually write to the author. So most articles have a corresponding author who can be contacted. And you can simply ask the author, you can tell them that you're quite interested in their journal. And then you can ask them to send you the full article. And most of them would gladly share their work with you in order for you to be able to access their articles if they are relevant to your research. So every journal has what's called a journal impact factor. So these are journals that tend to be indexed within search engines like PubMed. So an impact factor basically is just an average number of times that a paper that appears in a journal gets cited. So for instance, if I do a research on diabetes and that gets published in maybe the Lancet, which is one of the high impact journals. So 6 months down the line, somebody else wants to do a research that's also on diabetes, maybe not necessarily on what I have done, but something similar, at least within the domain of diabetes. My paper can get cited within that paper that's being worked on, and once that's published, that's a citation. And then the journal, if it's the Lancet that actually published that article, would be cited. So if that citation, they would look at the number of citations that journal has had within a particular time period, usually 1 to 2 years, and then that would determine what is known as the impact factor of that journal. So again, amongst the highly sought out or impact, the journals with the highest impact factors, at least within the medical domain, they would include journals like the Lancet and the Journal of American Medical Association, known as JAMA. Research methodology is quite important as well. So this would look at the types of research designs, whether they're observational or experimental, the sampling techniques that are used, and the data collection methods. Again, these are topics that would be delved on in subsequent lectures in more detail. Research studies. So research studies can also be subdivided into various types. So it can either be descriptive or analytic. So that's a research study that has different subgroups as well. So for the descriptive study, you can have a case report or case series wherein you may see an interesting case that may be a rare case, and an article can be written on it, or a thesis or dissertation can also be done on it if it involves a medical student, for instance. And you can also have descriptive surveys. So basically, these are just studies that are describing what the findings are without going into any analysis or any statistical analysis of such. So analytic studies can be subdivided into observational and experimental studies. So for observational studies, that will include cross-sectional studies, case control, and cohort studies. And we will take a look at this in our next few slides. And then experimental studies would be clinical trials, which are considered to be actually one of the highest level in terms of medical research. And we'll see why in the next few slides. The research design can be either of a quantitative research design, a qualitative research design, or a mixed method research design. So basically what this means, or the research design, is sort of like a master plan that specifies the methods and procedures for collecting and analyzing the needed information in a research study. So basically it's a blueprint on how, when, where data is to be collected and analyzed. And these would be dealt in more detail in subsequent lectures. So looking at the level of evidence, I did mention a few of the study designs. So the strength of your research can go anywhere from low to high. And being more specific in terms of levels, you can have anywhere between a level 5 being the lowest up to a level 1 that's the highest. So in terms of level 1, we would be talking about a randomized control trial or meta-analysis of randomized control trials with homogeneous results. So these would be considered the highest level of scientific evidence when we're looking at a particular question or particular research subject. Level 2 would be a step lower when you have meta-analysis of level 2, or you can have a comparative study, prospective therapeutic. Level 3 would be a retrospective cohort study or a case control study or meta-analysis of level 3 studies. Level 4 and 5 would be the lowest, where you have case series and case reports or an expert opinion on a particular topic. The type of studies, again, here what we see is a pyramid, and at the base of the pyramid you have case reports, case control studies and cohort studies, and randomized controlled trials, and eventually on top of that pyramid at the summit you have meta-analysis and systematic reviews or critical appraisals of particular topics. And again, this just shows the level of the strength of the evidence based on the type of studies that we're doing. So obviously at the beginning of your career, most of the times you would be doing a case report or case series, but as experience grows, you tend to go higher and higher up in terms of research, up to randomized controlled trials and systematic reviews and meta-analysis. So just to give a brief word on randomized controlled trials. So this actually is considered the gold standard when it comes to research. It's actually the most expensive, but at the same time, it's the most highly impactful type of study design in medical science. So basically, as the name implies, it's randomized, so there is a balance between confounders within a particular research population. So that's just to make sure that you're sort of eliminating those confounding factors that may give you false conclusions or false results. It is blinded most of the time. So what that means is, for example, a double-blinded study would be a study in which neither the participant nor the researcher know who is on what. So a practical example would be, for example, you would have maybe two arms in a clinical trial. So when I say two arms, it means two different populations that are being looked at. So they're different in the sense that one would be probably getting a particular treatment. If, let's say, we're treating hypertension, we can look at one arm being on amlodipine. If amlodipine was considered the gold standard when it came to treating hypertension in a particular population, we want to test our new drug against amlodipine. So our new drug would be the intervention arm, and then amlodipine would be your control arm, in which you're trying to test this new drug to see if it is as efficient or maybe perhaps superior to amlodipine. So in that scenario, when you have a double-blinded study, neither the patient nor the researcher would know who has or who would be receiving the amlodipine and who would be receiving the new drug. Sometimes you can have what's known as triple-blinded, wherein the research coordinator or the statistician, anybody above the level of the clinical researcher, would not know either who has which, whether it's the amlodipine or the new antihypertensive that we're trying to sort of test out. And it's important to note that in clinical trials, there's a concept known as PCOT. And again, this is just to make sure that the research question is well defined. So P would be your population that you're trying to study. So perhaps we're looking at male subjects who are above 50 in a particular geographical location, for example, who would be our population of study. And then the intervention would be, in the previous example, we mentioned a new antihypertensive drug against your control. That would be your C, meaning maybe a gold standard, or can simply just be a placebo, which would be compared with the intervention or the new drug that we're trying to see. O would be your outcome. So the outcome, for instance, would be dropping your systolic blood pressure by, let's say, 20 millimeters of mercury. That can be a possible outcome. So that has to also be clearly defined when you're doing research. And then T would be the type and the timing. So whether this would be over a 6-month period or whether it would be over a 1-year period. So that also needs to be defined when you're looking at randomized control trials. Cohort studies. So these are the next common type of study types in the medical literature. This is something that you would also see a lot of. So the interesting thing about cohort studies is that they start with the exposure and then tend to look at outcomes. And an example would be having a group of smokers who eventually would start off maybe from day one. And in the study, we would look at them in maybe 1 year, 3 years, 5 years, and 10 years, and then look at out of maybe 60 smokers, how many of those smokers actually develop lung cancer. So if you had maybe out of 60 we had 30, then 30 would be the outcome, in the sense that we're looking at lung cancer being our outcome, and then 30 out of 60 patients were got or came up with lung cancer. So that's something that a cohort study allows us to be able to do. So it can either be prospective, most of the times it is, wherein you start off and then you follow that population over the years in order to be able to look at those who eventually are faced with the outcomes and those who aren't. But a cohort study can also be retrospective, in the sense that we can look at it from behind, sort of like looking at the progression of that cohort. We can stand at the end of the cohort study and then look behind and see who amongst those who had the outcome, who had the exposures as well. The advantage of cohort studies is that randomization, when it's not possible for ethical reasons, or it's just not realistically possible. For example, you can't do a randomized control trial for, if, for instance, there was an atomic explosion, maybe accidental explosion, and you have radiation all over. You can't do a randomized control trial on patients to see what the effects would be in a year or two. So all you can do is sort of have the cohorts and study them, and then see, since they are the ones who had the exposure to radiation, and see what the outcomes are, within subsequent years. Also, cohort studies allow you to be able to look at multiple outcomes at the same time. So going back to the example wherein you had a group or cohort of smokers. So that cohort of smokers, eventually we're looking at lung cancer as an outcome, but we can also look at bladder cancer, for example. We can look at esophageal cancers as an outcome as well. So cohort studies have the advantage of actually allowing us to be able to look at multiple outcomes, wherein your randomized control trials do not allow that level of flexibility. Case control studies are studies that allow us to be able to look at rare outcomes. So rare outcomes, so these would be conditions or diseases that don't happen often. So if you're trying to do a cohort study in order to be able to study those rare outcomes, you'll be forced to have a very, very huge number in your cohort study. And this isn't always possible, in the sense that you would be limited either in terms of the number of patients you can actively recruit into that study, or funding constraints would not allow for an efficient study to be able to be carried out. So in those scenarios, you tend to have case control studies wherein you have a case that's already found and it's being studied, and then it usually allows us to be able to look at multiple exposures as well in order to be able to draw conclusions. Meta-analysis, so this is considered to be the study of studies. Generally, they tend to be similar studies with a particular outcome that we're looking for. So we're talking about the highest level or the highest quality of evidence when it comes to research. So when you do a meta-analysis of randomized control trials, so you're basically looking at multiple randomized control trials, just similar to each other, and that allows you to be able to eventually come up with a conclusion that is much stronger than each individual randomized control trial. So because in meta-analysis, you tend to increase the sample size by looking at all these different randomized control trials. And as we know, whenever you increase the sample size, you're able to eventually come up with conclusions or results that are much more significant, and you'll be able to draw better conclusions from those rather than individual studies. So again, this goes into the concept of study replication, wherein similar studies can be done in order to confirm the findings of previous studies and also add to the scientific knowledge that is already in existence. But for meta-analysis, you can also have a mixture. You can have randomized controlled trials that are mixed with observational studies, or you can have a meta-analysis of observational studies only based on the available information or scientific knowledge that's present. So again, this is the summary slide of the different types of studies and the evidence level. Obviously, meta-analysis and randomized controlled trials being at the top of this pyramid shows the level of evidence that they do come with. So basically, we've seen the different aspects when it comes to research. We've talked about the research question and how to come about a proper research question. And we've looked at the main types of studies that we can participate in when we're thinking of doing some form of research. In the next presentation, we are going to be looking at the very basics of medical statistics. We do have a module on statistics all by itself. We'll look at a few basic concepts that will prepare us for the statistics module. And we'll also look at manuscripts in the medical field and in medical research in general, what the different components of a manuscript would have to have in order to be able to be as comprehensive as possible.